And welcome back. Well, we know that every human is unique, and that includes our vision. Our next guest provides cutting-edge surgical options that make it possible to help you see things more clearly and reduce or even eliminate the need for glasses or contact lenses. If that sounds good, we're going to chat about it, because joining us now is Dr. Nicholas Bruns. He goes by Nick from Summit Eye Care of Wisconsin. He's here to talk about customized vision correction through refractive surgery. Good to have you back.
Thanks for having me.
It's so funny because during the commercial breaks, I'm always hitting you up on all this info because I think it absolutely shocks people to hear that even if they're over 40, even if they've got all these issues, there are options out there for them. So first and foremost, before we get to all the options, what is a refractive surgery? What is that?
Yeah, so refractive surgery is an elective procedure to eliminate glasses. And we like to think of it as a lifestyle choice, right? So some people are burdened by glasses or contacts, or maybe they just can't wear contacts because their eyes are too dry or uncomfortable. So it's an elective procedure that we can now eliminate glasses or contacts, or at least reduce your dependency on them.
Okay. So what if somebody has an astigmatism or some of the other things that they might complain about? What other things might they say to you are an issue for them in the past?
Yeah, so astigmatism is a big fancy word that just means kind of an irregular shape to your cornea. And most people have some astigmatism. And the common thought is, because I have an astigmatism, I can't go through LASIK. And that's just simply not true. It may mean you're a less than ideal candidate for LASIK, but we have other options. So ICL or RLE, it's a refractive lens exchange. There are definitely options. That's something that we're really proud of, to have the broadest range of options for patients in the entire state.
Yeah, so okay, so as we talk through this, LASIK, I have been told before, because I have astigmatism, I may not be a good candidate for LASIK. So first and foremost, what is LASIK, and then who is a good candidate?
Yeah, LASIK is a laser-based procedure where we gently reshape the cornea. The cornea is the clear front part of your eye, kind of like the face on your watch.
Yep.
We take a laser, we gently reshape it, and we kind of mold your cornea to match your glasses or contact lens prescription.
Is that what this is, or no?
This is called a refractive lens exchange. So for people who are not good candidates for LASIK, they may have too thin of a cornea or too misshapen of a cornea, we don't do laser because we won't want to make a problem worse. So instead, we take the lens out of the eye, put a new lens in, and in that lens, we can put your prescription. So different type of procedure, same outcome.
Okay, so now what is that one called? Is that the EVO ICL?
That is the light adjustable lens. The EVO ICL is a different procedure. So these are all kind of the same category, just different ways of, there's several ways to skin a cat, right? There's different ways of doing it.
Yeah, so do the EVO then. Do that next. So what is the EVO ICL?
EVO ICL is where we're not removing anything. So we're not taking corneal tissue away. We're not removing the natural part of the lens. We're putting a supplemental lens in the natural space that exists. So it's an additive procedure.
Okay, so who is a good candidate for that? And then how is that different than laser-based? So is there a laser involved, or this is more like a surgical thing?
Yeah, there's no laser involved with the EVO ICL.
Okay.
So people who are candidates for that may not be candidates for LASIK. Maybe you have too dry of eyes. Your eyes are too dry, too scratchy. Sometimes LASIK can make that problem worse. That's where EVO comes in.
Heard that.
The real big appeal for EVO is that it's reversible. So if for whatever reason you don't like the outcome, we can just undo it. Super easy.
Really?
Yeah.
Okay. So then people who, again, might not be a good candidate for LASIK for all those reasons you mentioned might consider the EVO.
Correct.
Okay.
Yep.
So then let's move on, because then there's the other one, the RLE.
Yes.
That's the retractable lens.
A refractive lens exchange.
Refractive lens.
Yes.
See, I'm not going to know any of these. Okay. This is why you're here. You're the doctor. Okay, so what is the RLE, and who's a candidate for that?
So people who are not candidates for LASIK or EVO, we start to consider RLE, because that is basically an early cataract surgery. We take the natural lens. A cataract is just a cloudy lens.
That's what we were seeing in the image earlier.
Exactly.
Okay, so go on. So you're taking the lens out.
You're taking a lens that's healthy. We're just taking it out and replacing it. So we're putting an implant in, and in that implant, that's where we put your prescription. So it comes down to, where are we putting your prescription? On the cornea, in front of the lens, or the lens itself? It's all a location, kind of a real estate problem that we've got, and that's what we're trying to attack. What's the best way for each individual person?
And who in general, how do you know this? Because I would think you want something that's customized for your eye, which it sounds like you've got some of the most customizable options out there. So how do you know? Is it just by doing an eye exam?
Different anatomical things and different lifestyle choices. Let's say you've got good distance, but you want to have reading ability. That might be more of a refractive lens exchange. Or let's say you've got you're just really highly nearsighted, that might be more evil. So the whole broad spectrum is extremely customizable, and every individual category is further customizable. So it comes down to just coming on in, letting us take a look, and doing a lot of measurements. There's a lot of math that goes in behind the scenes.
Sounds like it.
Determining what we need to do and how to do it.
Okay, so refractive in general, who would basically, like, how many of these have you done? Is this newer? Because I feel like you guys are the first people to really introduce us to all of these ideas.
So it's not, the different categories of procedures are relatively new, but the concept of refractive surgery is not new. We've been doing this since the early 90s. Dr. Vukic, my partner who couldn't be here today, has done probably close to 30,000 procedures in his career. He is fantastic. He's been around the block a couple times. He has seen it all, and he is the top in the Midwest.
That's pretty incredible. So the process then would be somebody comes in to meet with you, and you really can go through the options as you discuss what's really bothering you.
Yeah, you get a 2-for-1. So you get Dr. Vukic and myself, two completely separate opinions, which is, it's a good thing.
Yeah.
So you get two very different points of view, and we talk. Every case that comes in, we talk. I say, this patient might be good for LASIK, or maybe this one's good for EVO ICL. He may say, no, you know what, probably not. Let's go a different route. And we talk about it. And so you get two totally different separate opinions. That's all part of the process.
I love it. I love it when you're here. I always learn so much, Nick. It's so great to have you here. Thank you for joining us.
Yeah, thank you.
Absolutely. Right now, Summit Eye Care of Wisconsin has this special offer for the next 3 months. Any patient electing to have refractive surgery to improve the quality of their vision and life will also be sponsoring a sight-restoring surgery for someone with cataract blindness. How cool is that? So to find out if customized vision correction surgery is right for you, or if you just want to learn more, go to their website. It's summitiwi.com. You can also call them. It's 414-877-6414.